This is Alice.
I'm Alice.
How old are you?
3.
We found out that she had neuroblastoma, but she had a particularly aggressive form of neuroblastoma. When they stage it, if she carries a cell called the Miken cell, which amplifies the tumour, makes it grow quickly and more aggressive, it puts her into the highest stage, the highest risk category.
Neuroblastoma is a cancer which is almost always seen in children, and it's usually, not exclusively, but usually seen between around the ages of 1 and 4. It is a tumour which arises from the nerve cells, which are mainly in the abdomen or chest. For high-risk disease, the prognosis is not particularly good, so it's about 50-50, so you've got a 50% chance of survival with high-risk disease at the moment. And there's kind of acknowledgements amongst people who work with neuroblastoma that the current treatments have almost reached a maximum, and a lot of the benefits in survival have come from intensifying chemotherapy, but there's probably that's about as intense as it's going to get in terms of the side effects that children will tolerate.
She has probably had side effects to every part of the treatment, every little bit. So the treatment that is there at the moment it's hard. It's really harsh on her body, it's harsh on her. It's also that we don't know what's going to happen in the future. We don't know what effect it's got on her body later on. We know potentially she won't grow to the full height that she should. We know that there's a very good chance that she will never be able to carry children. So even though this bit might be over as you go along and we might well get to the end of treatment, but in future we just don't know what else is going to happen. So if treatment could be found that is not so harsh and it's not going to affect the body quite as much and quite as badly as it does at the moment, that would be incredible.
In my lab, we're interested in the way DNA gets damaged and DNA gets repaired. And one of the things that's common to all cancers is that there's changes in that process. And we know every day that our DNA is damaged but effectively repaired in normal cells. However, what we were interested here is how that process changes in neuroblastoma and whether we can exploit those changes in order to specifically kill cancer cells, leaving the normal cells around the tumour unharmed. And in that way we hope to develop kinder and more tolerated therapies for patients.
So olaparib is a specific type of drug, and what we found using lots of different tests in the lab was that neuroblastoma cells would die more with olaparib compared to normal cells. What we hope is that more targeted treatments like olaparib, for example, in neuroblastoma may help to reduce some of those side effects. So what we want to do is just kill the neuroblastoma cells but leave other cells in the body all right, not affected, and so hopefully our treatment will work.
And olaparib has been used successfully in women with breast cancer and ovarian cancer, and therefore we're optimistic that this could be translated fairly quickly into children with neuroblastoma.
As a parent, you know nothing about neuroblastoma, you've never really heard of it. You understand when you get diagnosed that the prognosis is 40-50% of survival after all of that treatment, and you realise that the research is sort of lagged behind a bit really, and the treatment being so hard hitting, it's so vital. Charities step in and fund the research.
If it has some impact on what the children have to go through whilst having the treatment and therefore after, you can't put a price on it. It's incredible.
All the funding for this work has been provided by Children with Cancer UK.